this recording. Okay, Mira, over to you, my dear.
Thank you. I'm just going to get rid of this. Oh, hang on. There we go. Yes, hello everyone. Thank you, Abuna. So I'm Mira. I'm a GP. I've worked and lived in Liverpool for 10 years, and now I work and live in Norwich. So Abuna asked me to give a talk about anxiety in a community setting, and I thought I couldn't really talk about anxiety without mentioning depression, because anxiety and depression go so hand in hand that it's almost very difficult to separate the two. So this is going to be about both anxiety and depression. And I thought I'll tell you how common it is, what some of the causes might be, what some of the symptoms might be, the treatment options, what the stigma around anxiety and depression could be, or some of the stigma, and what not to do. And then at the end, do some things that I thought might be helpful, or some ways that we can help people who are struggling with their mental health. As a disclaimer, so the first bit with, you know, the causes, the symptoms, the treatments, I am speaking as a GP who's studied about mental health, but the last 2 points, the stigma about the church, what it is in religion, I'm in no way obviously saying what the, you know, I'm not speaking on behalf of the church. This is just my opinion and my opinion only. And Abuna, please feel free to jump in and say, you know, if this is not right, or if this is not what the church actually believe in. So how common is it? It is very, very common. So I personally, without even having looked at the statistics, about a third of my day is normally treating or dealing with people with either anxiety and depression, either new diagnoses or follow-ups. So this is a study from 2014, so this is well before COVID, and it was shown that 1 in 4 people will experience a mental health problem each year in England, and 1 in 6 each week. And actually, this data is not including anybody who's in a hospital, in a prison setting, who's homeless, who's in sheltered housing. And we know that these people are the most vulnerable people. And actually, if we include the numbers, they're going to probably be way more than, you know, the 1 in 6 are diagnosed in a week. And the sad thing is, if you see the bottom line, only 1 in 8 of adults with a mental health problem are getting any treatment of any kind. And that just doesn't mean just medication, it's any treatment. So even though it's really common, not a lot of people actually come forward and get the help they need. So that's why I think it's a really important problem. And as I said, this is well before even COVID hits. This study is from the Office of National Statistics, and it just shows how some people are a lot more vulnerable to having common mental health problems like anxiety and depression. So you've got the young adults. So if you're young, you're more likely, or you're more vulnerable to getting anxiety or depression. Females a lot more than males. If you've got disability of some sort, if you are clinically extremely vulnerable, and if you remember when COVID was in its peak, the people who were getting shielding letters, these are the people who are clinically extremely vulnerable, and they are more likely to suffer from anxiety and depression than if they're not. And then anybody who is actually living in deprivation, which is like homelessness, substance abuse, contact with the criminal justice system. So those are just people who are more vulnerable to it, but it doesn't mean that other people who are not in these categories do not also suffer from anxiety and depression, because it can affect all ages, all social classes, and both genders. And this is a study after COVID. So between 2019 and 2021, the cases have actually doubled. So COVID seems to have doubled the cases of anxiety and depression. And in fact, NHS England is predicting that 10 million people will struggle with their mental health as a direct result of the pandemic in the next 5 years. So it's a problem now, and it's going to become an even bigger and more common problem. So what are some of the causes? Actually, nobody really knows a cause. And I don't think there is one cause. I think it's normally a combination of lots of different things. And unfortunately, COVID has actually impacted almost every single one of these points. So the first thing is like childhood experiences. So how you were brought up, what kind of household you lived in, if you've been bullied in school, if you've been told that you're inadequate, if you couldn't make friends, if you're excluded, if you were witnessing or a victim of domestic abuse or domestic violence. Then you have life events, just bad things that have happened. So unemployment, if you lost a job, lost a loved one, a big move, a big life change. And again, COVID fits very, very well with that category. Other mental health problems give rise to anxiety and depression. Physical health problems, so people with chronic diseases like diabetes, like high blood pressure, and again, COVID has actually made that a lot worse. So a lot of people post-COVID, they have either got post-COVID syndrome, or if they've got some lung problems, chronic lung problems because of it, they're no longer able to do what they normally did before. They can't, they've got fatigue, they can't really carry on with the things that they did before they had COVID. The next bit is genetic inheritance, but again, there is no gene that is the carrier for anxiety and depression. But if you've got a parent or family member with anxiety and depression, you're more likely to have it. Whether that is nature or nurture, it's really hard to say. Because also, if you're living in a household with a parent with either anxiety or depression, you pick up habits unintentionally. You just absorb some of the negative habits that they've done. And then next, medications, some recreational drugs and alcohol. Some medications can actually be a cause of depression or anxiety. And poor sleep, poor diet, and lack of exercise. So these are some of the causes, and a lot of the time it's a combination of multiple of these causes. So when somebody comes in who is vulnerable, who does have a chronic condition, or who's just looks like they might have it, there are two questions that we ask. And if the answer is yes to either of them, then they may potentially have the diagnosis of depression. This is not to diagnose them, this is to kind of point us to the fact that they may have depression. And therefore, we should do more questions and more investigations with them. So it might be actually helpful for the people who are here to ask themselves these two questions. And the first one, they're both very simple. During the last month, have you been feeling low, depressed, or hopeless? Yes or no? And during the last month, have you often been bothered by having little interest or pleasure in doing things? And again, if the answer is yes to either of them, you might actually have depression. And if you are struggling, then please go get help. Don't try and diagnose it yourself. I'm not really going to focus so much on diagnosis, because I really think it's not a good idea to self-diagnose, even if you are a medic, even if you are a psychiatrist. It is always a better idea to go get help from somebody else so that you can have follow-up with somebody else. But these are some of the common symptoms that might point to depression. And they're, as you see, they're listed in depression. So the first one is low mood, loss of energy, being tired, losing any pleasure in things that you used to enjoy before. So for example, if you used to enjoy reading, you no longer find that pleasurable. The R is actually for if you're moving or doing things that are so slow that other people would have noticed, or the complete opposite of you're always fidgeting and doing things really fast. The E is for eating change. So your appetite could go up or down, your weight could go up or down. Sleep change. So again, you could be sleeping too much or sleeping too little. Suicidal thoughts or thoughts of wanting to hurt yourself. Feeling like you're a failure, that you've lost confidence in things, that you don't have self-esteem anymore. Self-blame and guilt is a really, really big one. And that's one of the things that actually stops people from getting help, that they just feel so guilty all the time. And a lack of concentration. So that's some of the symptoms with depression. The next thing is to do with anxiety. Anxiety is not an illness in itself, because actually not all anxiety is harmful. So for example, if you're in a jungle and you see a lion approaching, it is completely normal to have anxiety. In fact, a lot of anxiety, because that's what kicks off your fight or flight response. That's when adrenaline kicks in, and that's what allows you to get out of the situation you're in. So it can be very useful, and we all have an element of anxiety. However, it becomes abnormal when it's either out of proportion to the stress. So for example, if it wasn't a lion that's approaching you at all, if it's just a tiny cat, and you're not terrified of cats like I am, or it persists when a stressful situation has gone. So it's carried on even though you're out of the actual stress, or it's just simply happening for no apparent reason to multiple things. So I found this graph that shows that anxiety can actually be a good thing if it's in moderation. So you can see that the bottom line is arousal, so how anxious you are, and the top is performance. So if you've got absolutely no anxiety, no motivation, no arousal, no interest in anything, if you're on the low side, your performance is going to be pretty low or non-existent. So let's say you've got a deadline coming up, you've got a paper to hand in, you've got an exam coming up, and you've got no adrenaline in your system, nothing to drive you, then your performance is going to be very poor. And the higher that gets, the more your performance is going to be. However, if that goes over if it becomes too much, so if you're looking at the right side of the screen, when you go to the high level, the performance starts to dip again. So you're really trying to be in the sweet spot in the middle where you just have enough drive to make you work well, but not so much that you are struggling to do anything with your life at all. And the thing that we'll talk about is the generalized anxiety disorder, and that's the one that is abnormal anxiety for lots and lots of things, not just specific to one single thing. Lots of different physical symptoms of anxiety. So you could be restless, you could be tired, you could be struggling to concentrate, irritable, sleep disturbed, muscle tension. So lots of physical things that could go hand in hand with actual anxiety. So talking about the diagnosis, talking about how common it is, the next thing is the treatment. And as GPs, it's very much drilled into us that every single condition has got this biopsychosocial approach for management. And that is even more important when it comes to mental health. So bio is biology, so actual medications, medicines. Psycho is psychological. Is there any psychological things that can help? And social, any social treatment that can help. And again, these things are actually extremely important in mental health. And I would say that it's written as the other way around. So I would put social first, then psychological, then biological. So here are some of the treatments that we often use in the surgery. We've got social prescribing, lifestyle changes, psychotherapy, which is psychological interventions, and medications. The first thing is the lifestyle changes. So the NHS has actually produced a leaflet called the 5 Steps to Mental Wellbeing, and it lists those top 5 points as the 5 things that help anybody have good mental well-being. So it's useful for, if you've got depression or anxiety, or if you just want to have good mental health. So the first thing is connecting with people, then being physically active. Anything at all that boosts your heart rate is good, because that improves the happy chemicals in your brain, and that makes your energy and your motivation and your self-confidence a lot higher. Then we've got learning a new skill. Again, that boosts self-confidence and self-esteem and gives you a purpose in life. Giving to others, and paying attention to the moment and mindfulness. And I actually, when I looked at those 5, I thought a lot of them could definitely be incorporated in our church as a way of helping people maintain their mental well-being. So connecting with people, we're all part of the same community, the body of Christ. Giving to others, it is really important that as a church that we are a giving community and actually helping the people around us. Paying attention to the present moment, I thought things like the tasbiha and things like the praises that we do, it just helps you focus on God and what is happening around you right this minute. So the first 5 points are in the NHS 5 Steps to Mental Wellbeing leaflet. The last 2 are also extremely important, and we always recommend them to everybody who's struggling with their mental health, and that is how well they're eating and how well they're sleeping. Because if you're eating rubbish, then you're going to be feeling rubbish. And I have often myself been feeling really jittery, and later on realizing that actually I've drank, however many cups of coffee, and therefore I'm feeling very jittery and anxious. Or I've just, eaten a lot of sugar, and now I'm having a crash after all the sugar that I've eaten. And if you're not sleeping, then you're not recovering, and therefore you're going to be feeling tired, which is going to be adding on to your anxiety, depression symptoms. So first thing, lifestyle changes. Second thing is psychotherapy. There are lots of different types of psychotherapy, but there are 2 that I want to focus on today, because I actually think that these 2 help everybody, not just people with mental illness. Because if you can master them, and I've spoken to a psychologist before about this, and she was saying that actually you're supposed to develop these habits when you're well, because then when you become unwell, they've become almost second nature to you. and they will really help you cope when you do become unwell. First one is CBT, which is cognitive behavioral therapy. Found this quote, well, say I found it, actually David found it, from St. Basil. And he was saying that we change in our body as has been shown, and in our soul and in our inner person, always shifting our thoughts with the circumstances. In fact, we are one sort of person when we are cheerful and when all things in life are moving forward with the current, but we are another sort in precarious times, when we stumble against something that is not according to our wishes. So he's saying that our behavior does change depending on our circumstances and depending on what we are facing right this minute. And this is the main drive behind CBT, is that actually life is what our thoughts make it. It's how we see the world that counts. So you've got the situation or event, and then it depends on your own interpretation of it, is how you will feel and what your emotions will be like. And this is what drives how we behave after that. So some of the things that we could be doing is doing this thoughts, feelings, behavior, reaction cycle. So for example, a situation is happening, like I have had to prepare for this presentation today. My thoughts could be that I am, I'm not going to be very well prepared. I'm not equipped to be giving this talk. I'm not good enough to be giving this talk. Therefore, my feelings will be anxious, scared, worried. My behavior would be, I may not eat or maybe eat a lot. I probably will not be sleeping. I will be, pacing around. Physical reactions, heart racing, maybe sweating. And this again drives the fact, goes back to my thoughts being, well, yep, I am really anxious, therefore I'm not going to be doing a good job. And that's the cycle of how the situation can be interpreted completely differently. And what CBT tries to do is actually break this cycle, because I've recommended CBT to a lot of patients, and a lot of them would say, I've tried counseling before, it did not work. I do not like talking about my past. I don't really want to delve into my childhood. I don't want to, I'm not a talker. A lot of men say I don't like talking. So I'm not really into talking. But actually CBT has got nothing to do with delving into the past. It's about treating what is happening right now, about how you stop what you're feeling from affecting the way you're behaving. Because feelings are just feelings. They are not based on actual true thoughts and true events. So this is examples of negative ways of thinking. So you can be thinking things like, either everybody is going to say I'm amazing, and if they do not, then I'm a complete failure. You can be predicting the future, fortune telling. So you could be saying things like, this is not going to work, it's never worked before, it will not work right now. You could be mind reading. So you walk into a room, you see somebody and you say, oh yeah, they do not like me, they think I'm useless. You could be taking things personally. So again, you walk past someone, they don't make eye contact or they don't smile, and then you say, they do not like me, they're angry at me, it's probably because of something I did, etc., etc. There's a lot of thinking styles that can be broken if you really analyze it well. So things like, what makes you think this is true? What could be going against this idea? Is there a different explanation why somebody didn't smile at you? Maybe they didn't see you, maybe they were preoccupied by something else, maybe they were depressed themselves. So there are lots of different steps for going through thoughts and analyzing thoughts. And this is an example of a sheet that is given to somebody who's doing CBT, where they put the situation, the mood they're in, the automatic thoughts that immediately come in. Then they start thinking about it. What supports this thought? What doesn't support this thought? And is there another alternative, more balanced, more appropriate thought about it? It's hard to do CBT by yourself, but one of the things I really like is this Woebot app. It's an artificial intelligence app. It's not actually connected to anybody, so there's no physical person to go with it, but you write down how you're feeling and this Woebot answers back. So they answer back with things like, are you sure that this is true? Is this maybe a type of fortune telling? Is this maybe a type of black and white thinking? And they get you to really think and analyze what your thought is, and to then rewrite it in a more positive and constructive way. So I recommend this Wobot app quite a lot, and it is a free app. And another thing, you can use a workbook to try it. So this cognitive behavioral therapy is a workbook that you can buy from things like Amazon and go through it yourself. And again, these things you don't have to wait until you're depressed to actually try them. These are really important to retrain your brain. As it says on the side, retrain your brain. Different type of, not a different type, a different aspect of CBT is about scheduling activity. Because a lot of the time you might feel really tired, you might feel like I don't want to do anything, but if you're actually physically putting things in, things that will give you pleasure, things that will give you a sense of achievement, you might say I don't have any time, but if you lay out your activity hour by hour, half hour by half hour, then you will find some time. And once you start doing something, then it gives you this, the dopamine starts to kick in and you start feeling this amazing achievement and amazing sense of pleasure, which would want you to do it again and again. So that's a different focus of CBT, and not just thoughts, but also activity. Second bit of psychotherapy that I tell people about is self-compassion. So it's basically showing compassion to yourself. So the compassion that we're supposed to cultivate for others, turning it onto yourself. And it's not in any way selfishness or self-indulgence or narcissism. Because when God says, love your neighbor as yourself, if you don't actually like yourself, then what's the point of this commandment? And there are so many verses that I've not put any of them in because I didn't even know where to start, about how God loves the world, about how we are so important to God, about how even the number of our hairs is counted by him, more important than the sparrows. So there is obviously this Christian idea that we are really loved by God. So why can't we be compassionate and show this love to ourselves? There is a whole module about self-compassion, but I've just picked out this diagram from it. And it's basically, the idea is, what would you tell a friend if they're going through this thing? So if somebody says to you, I am a terrible mother and wife, I am not good at this job, I think I should just quit. What would you tell this friend? Would you say, yep, you are actually terrible? Or would you try and soothe them? Because when you activate the soothe system, it actually takes away the threat system. And it's the threat system that leads to feelings of anxiety and depression and shying away from the situation and just wanting to give up completely. So that's another, and there's a whole, lots of studies about it, but there's an actual handbook with modules that you can do to improve your self-compassion. Next is medications, and I'm not going to really talk about it because it's not a medical talk, but there are lots of different types of medications. They can treat some of the symptoms of anxiety and depression, but it doesn't actually address the cause. So therefore, combination treatment is always very important. Medications have a really important role in helping people who are significantly depressed, because when you are at a stage when you are, got moderate or severe depression, you're struggling to start the process anywhere. So you're starting to look at you're struggling to look at your thoughts, you're struggling to do any activities, you're struggling to even get out of bed. You probably will also have some thoughts of wanting to harm yourself. So medications are really helpful to break the cycle and give you just the boost that you need. But then you'll need to take it forward with more psychological therapy after that, alongside the medications. And then probably more importantly than all of the above is social treatment. Because if somebody is homeless, they're in debt, they're unemployed, they're going through domestic violence, they really would not want to be doing any of the above things. They don't want to do psychotherapy. They don't want to take, medications might just mask the problem. But actually, until they are out of this mess that they're in, out of this terrible circumstances that they're going through, they're not really going to heal, or they're not going to start the treatment properly. So our surgery, and a lot of surgeries, I think most surgeries have got access to social prescribing. And that is just somebody who spends half an hour, 45 minutes with the patient, going through what the actual problem is and signposting them and directing them. Because a lot of people, when they're in the actual problem, they don't really know, or they don't see a way out. They don't know what help is available, so they don't really know how to help themselves. So social prescribing, that's where it comes in, where they signpost people to where they're supposed to go. And Life Rooms is actually something that is in Liverpool, that is like a recovery college, where you get some degrees to give you more of a sense of purpose to go back to work. So that is the treatments of it. So biological medications, psychological is psychotherapy, social is the social prescribing. And of course, lifestyle covers both social and psychological. As I said before, only 1 in 8 people actually access help or access any treatment of any kind. And why is that? The main thing is stigma. And it's not just in the Coptic church, it is everywhere. When it comes to medications, people think it's a sign of weakness, a sign of laziness, they've given up, they're just wanting the easy way out, when in fact, that's not true at all. I know that some people think it is self-inflicted, that is because, you just need to get up and go and do something. We're all struggling, so what do you want me to do about it? What makes your struggle more special than my struggle? And I do know that some of the Christians believe that it could be a lack of faith, that you just need to go and pray some more and you'll be fine. Or even worse, that it is a punishment from God, and that is a sin that you're doing. So you've got depression, therefore this is a sin. I have read a meta-analysis that somebody combined over 200 pieces of research on spirituality and mental illness. And they found that on the whole, spirituality actually helps boost people's mental well-being, and it helps people recover from anxiety and depression. However, the instances where it is harmful is when religion promotes guilt, it promotes fear, it promotes anger, and it makes you isolated from the rest of the community. So I think we have to be really careful on promoting people's awareness that it's none of the above, none of these things, that it is a condition like any other condition. And then when it comes to suicide, I've had people say, these were not Copts, these were actually Catholics, who would come and say, I'm getting these thoughts, I don't want to be here anymore. However, I would never act on it because I am terrified of going to hell, because I believe that if I kill myself, I'm going straight to hell, which is scary. And it's really scary for somebody who's already depressed and feeling guilty and feeling miserable in themselves. But I suppose other people might look at it and say, well, if this is something that stops them from acting on it until they get help, then maybe that is a good thing after all. But I'll leave that up to you to decide. I'm not really sure which way to go. But either way, religion can have a really strong impact on how people cope with the troubles that they're going through. And I thought I would put some quotes from the Bible that I thought were really helpful when it comes to people who with depression in the Bible. So it says, in Romans, it says, for we know that the whole creation groans and labors with birth pangs together until now. So everybody is struggling. The whole creation is struggling. It is not just specific to people who've got, this is not a punishment for a specific group of people. Everybody is in the same boat. So somebody like Hannah, who's Samuel's mum, she was in bitterness of soul and prayed to the Lord and wept in anguish. And God gave her Samuel. Somebody like Elijah is actually a story that I really like. So this is when Ahab and Jezebel were persecuting the prophets, and Jezebel wanted to kill Elijah, and therefore he fled. So it says in 1 Kings, and he prayed that he might die and said, it is enough now, Lord, take my life, for I am no better than my father's. So this is somebody who was obviously extremely depressed to the point where he was having suicidal thoughts. And I thought that the way God dealt with it was extremely good. Well, I mean, that he is God after all. But you cannot tell Elijah, well, actually, you just need to go and pray some more. Or, what have you done wrong? Why are you depressed? You shouldn't be depressed. Because Elijah is a prophet and he was actively talking to God. And in fact, he was talking to God right there and then. And perhaps that's why God listened to him and tried to help, because he has brought his troubles to him. But actually, the first thing that God did was feed him. So he gave him food twice. So first thing is looked after his physical health, because he's got a big journey to go on and he wanted him to have the strength to go on this journey. So he fed him first. Then he asked him gently, what are you doing here, Elijah? And Elijah started saying things like, everybody is bad. I'm the only one who's still prays to you. They're persecuting all of your prophets. So God showed him in a really gentle way. Lots of wind came, God wasn't there. Earthquake came, God wasn't there. And then in a very quiet voice, that was God. And then when he asked him again, why are you here? Elijah said the exact same answer. I'm the only one left. They're all persecuting your prophets. And God, that was to me, that sounds very much like, black or white thinking. It's only me and nobody else. I'm the only, everybody else is bad. It's fortune telling, everybody is not good. So there's lots of thought problems going through Elijah's head. And what God did, he explained it very gently. Actually, that's not true. There is still 7,000 people who have not, who are still mine in Israel. So I thought that was really, really good CBT at its best. That Elijah came with lots and lots of thought problems that were completely wrong, and God just corrected it in a really gentle way. And the same thing happens with Moses. Again, I'm not able to bear all these people because the burden is too heavy for me. If you treat me like this, please kill me here and now. I have found favor in your sight, and do not let me see my wretchedness. Again, he was struggling. He expressed that he didn't want to be here anymore. And what did God do? He gave him people to support him. He gave him 70 elders to actually take the burden. Again, Jonah, same thing. He went to Nineveh, wasn't happy with the outcome, said, it is better for me to die than to live. And God taught him in a really gentle way. When he made the tree grow, he slept under his shadow, and then it withered away in the morning. And he was showing him a practical lesson on compassion. So all of these people, you can't say, actually, you all just need to pray some more, and this is all a punishment from God. This is a real experience that they were going through, that God helped them through it, and did not shout or say, how dare you feel this way. The next person is Paul, and we all know that Paul had lots and lots of troubles on his missionary work, arrested lots of times, persecuted lots of times, and he also said, we were burdened beyond measure, above strength, so that we despaired even of life. But the good thing at the end is actually, and that will bring me to the next point, he said, you also helping together in prayer for us, that thanks may be given by many periods on our behalf for the gift granted to us through many. So he was actually thanking the people for praying with him and for him and his companions. So that brings me to the next bit. What can we do? We are all a community. We're all living together and supposed to be supporting each other. So the first bit is community living and support, and the second bit is understanding and inclusion. So we are created as a community. We're all created as the body of Christ. There is no reason why the churches should not be open and available and inviting everybody. There is no reason why people who are vulnerable and isolated, for example, single parents, people with dementia, elderly people who don't have anybody to talk to or anywhere really to go to, there's no reason why they should not have somewhere to go, be included socially. There is this idea in Liverpool called the Mental Health Cafe, and I know that the church can't really do it properly, but this is a place where people with mental illness go, and they have mental health workers dotted around to be able to provide help and support and signposts. And I know that can't happen in the church because you don't have the professionals to lead this, but why don't you just invite them in so that they feel like they are part of a community and that they have some sort of activity scheduled? And these are verses, and I couldn't even begin to choose which verse supports that we are all supposed to be praying together and living together. The second thing is understanding. So mental health awareness, and I know that we've already done talks about autism, about learning disabilities, different talks about mental health. So we're already starting the awareness and telling people that this is a problem, and this is a problem that is very likely to get worse and worse, and that it's no shame in getting help for this problem. There should be some sort of leaflets and posters with important contacts, because it's all well and good hearing this when you're well, but when you're actually struggling, everything gets out of your head again. So it's good to have, leaflets around and posters around so that people know where to go when they're actually struggling. Don't forget that no answer fits everyone. So if something works for somebody, it doesn't mean it's going to work for the next person. So make sure you're adapting things to suit every individual. You might say, well, how am I going to help? I can't even begin to fix this. I'm not a mental health worker, but actually people just want to be heard. You just need to be there and listen. Even if you can't fix it, it doesn't really matter. If you check on them, if you are showing that you're available, if you're maintaining their confidentiality, that's all they need from you, really. And also don't forget to give people excuses for not wanting to engage. So let's say you invite somebody out for, I don't know, a group meal, and then the last minute they say, we're not coming. That could very well be because their anxiety is just so severe that at that minute, they cannot leave their house. It doesn't mean that they do not like you, they don't want to spend time with you. So please give people excuses for not wanting to engage. Or if somebody hasn't phoned in a while, don't be, down their throat saying, well, why haven't you called me? It could be because they're going through multiple other things. This is something that I found in a church near where I live right now. They have got this stand at the back of the church with lots of little leaflets and little cards that you can take home with you. So people go to churches often as a place of refuge, and often when they're feeling quite upset. So if they can find a card, for example, that says feeling sad or anxious, they pick it up, the back of it says a prayer, and it says, you can call this number if you need to talk to somebody. That might be something that would be useful. What not to do is, this is from a personal level, not from a church level in any way, just because I haven't actually mentioned the negative things that you can do, and that would be over under eating, alcohol, drugs, gambling, and self-harm. So I'm not really going to go too much into that. I thought I would so I'm finished now, but I thought that at the end, I'll just leave some resources for people to access help. So the first one is in an emergency. So if everything is really on top of you and you're extremely struggling, you might even have thoughts of, wanting to self-harm. Where do you go? There is the crisis team number, which is specific to each region. So I couldn't put it in the slide. There is NHS 111 and press option 2. You can send this text to this number, shout, and they reply back with, you deserve support. We are going to connect you to a professional, and that's all via text. Or you can ring the Samaritans. Liverpool has this Liverpool Life Cafe, which is something similar to A&E for mental health. So these are the emergency ones. The non-emergency ones, there's lots of different types. So if you're struggling, there's so much out there. The first bit is something called quell.io, which is actually something that I've just come across. I wasn't aware they existed before. They do all of this. They do online messages. They do booked and drop-in chat. They have lots of content. They have a community support with forums. They have personal development tools. There's lots of different resources. The second one is the well-being services, which is the most common one that's offered by primary care. They offer all sorts of psychological help, like CBT, etc. This is the self-compassion module book. Lots of self-help guides. Change, Grow, Live is for drugs and alcohol. We've got your bereavement services, relationship counseling. You've got resources specific to young people. And you've got resources for parents and carers. So this is where we signpost people who are struggling. And that's all. Any questions?
Thank you very much for that, Mira. That was really, really interesting. And it's going to be useful to distribute your presentation to our youth and to others in the church. I guess one question I have is what's your daily experience like as a GP? Do you find that people come just with mental health problems, or do you find normally that people present with a mental health problem as well as other problems? Is it something that's just a special group of people, people with mental difficulties, or is it something that everyone can experience and is experiencing?
I think it's something that everybody's experiencing, actually. So it doesn't matter what the problem they've come in with. Almost everybody has some sort of degree of anxiety and depression. So let's say they've come in with diabetes. They're coming in for the diabetes review. They're going to have this sadness about it, that it's taking over their life, that it is something that they now have to live with. They're mourning the life that they used to have when they used to eat everything. They're tired, which is making them feel depressed. So actually it plays a part into every single aspect. Lots and lots and lots of young people, especially high school age students, coming in with such significant anxiety, all related around exams and all related around how the school is putting a lot of pressure on them. So it's almost in every single consultation. And even if it's not direct, if you open up the person's medications, actually an antidepressant is one of them anyways. So it's just extremely common.
So if we were to think about our life as Christians in our own Coptic Orthodox communities, really we should be looking at one another as people potentially struggling, maybe in silence, maybe in ways that we can't quite see. Maybe someone is a bit quiet in church. They're not ignoring us, you know, they're not in a bad mood with us, but maybe they're struggling with something we don't know about, something at work. Maybe they've been diagnosed with an illness we're not aware of. We do need to pick up on this, because this is the experience of most people in our communities at one time or another, and of ourselves. And even for our own sake, we need others to be aware that maybe sometimes we need them to say to us, it looks like you've got things on your shoulders, Abuna, you know. So this isn't something that just relates to a special group of people that we hope we might never be. This is something that whenever we have a problem in our lives, we may experience stress leading even to depression. Is that the right way to look at it?
Yeah, definitely. And as you said, just saying, you know, it looks like there is something going on, Abuna. Are you okay? Just even saying that, it will just open up the gates to a lot of things. And if they were actually okay, then they'll say yes, and that's it. But more often than not, they're going to come out with a whole spiel of, you know, why they're not okay. And that happens, you know, if I'm seeing a child with the parent looks stressed, and I look at them and say, you look stressed. And it's like a whole 10 minutes of actually breaking down and saying, yep, there are lots of things going on. So yeah, it's really important to give excuses to people and to just be there. Just be there. That's all you have to do.
Yes, thank you. Others of you, do you have questions or comments you want to raise? We're all in the same churches together. Many of us have struggled in the past, or are struggling now, or have families and friends that are struggling. So what's your comments or questions? Some of you have unmuted your microphones, so speak out. Rafat, go on then. Rafat, please.
Hi, Abuna.
Hi.
Can you hear me?
Yes, I can hear you.
Hi, Mira and Dave. Thank you very much. It's a lovely talk, and we are missing you.
Us as well.
Thank you. It's just the definition you put regarding the diagnosis of depression and anxiety. If you put it as the way you put it, it will make everyone getting worried about the diagnosis. How can you, about the frequency of the symptoms, or the frequency of the occurrence of the criteria you put it, how frequent you will be going through these symptoms to make somebody say, well, I'm getting worried, I need to be looking at this as a problem, I needing to be going to ask about, is this a real problem or something like that? Would you elaborate a little bit more about this point?
So actually, I didn't put it in on purpose, because I thought I don't want people to look at this and say and start diagnosing themselves. I just want them to feel like if they are struggling, to go and get help from somewhere. I didn't want them to be looking, you know, I could put down the, so technically with generalized anxiety disorder, you have to have had the symptoms persistently all the time for a period of 6 months. For something like depression, you go through this questionnaire, the PHQ-9 questionnaire, and it says, over the last 2 weeks, how often have you been troubled by the following? For example, loss of pleasure in things. Not at all, more than half the time, less than half the time, nearly all the time. So, and that brings you a score at the end. But I did not want people to actually look at it and start scoring themselves, because that can be quite dangerous. They could either underdo it or overdo it. So it's just a way of saying that it is so common, because everybody has gone through some of these symptoms at some stage of their life. And if you are struggling to cope, then please go and get help. Not everybody will be diagnosed with clinical depression. Some people might just have stress. Some people might be going through a bad period in their life, and they're going through an adjustment of some sort. So it's not a way of diagnosing them. It's just if you don't feel right, if it's affecting your life in any way, then go get help.
If I can add, I think that this shows, especially for people we know are vulnerable, we're thinking of all of our youth who have gone away to university for the first time, for instance, but also people around us in the congregation. Do you think it's better, Mira, for us to be people who are asking people how they are, instead of waiting for people to feel, I'm really, really bad and I need help? Of course, they might need professional help, you know, and that might become severe for them. But is it not better for us to be in contact with people regularly, so that we are often in contact, say, with the young people who have just gone to university, so that we're asking them, how have you got on this week? How are you feeling? What stress are you under? Is that a better way for us to deal with it, by asking people instead of waiting for it to get so bad they really realize they need help?
Yeah, I think it's a good idea to show people that you care and that you are there for them and that you are thinking about them. I'm not sure if kind of asking them, are you okay now? Are you okay now? If that's something that might be a bit too intrusive, maybe. But
no,
just
I don't mean that quite so diagnostically, you know. But
keeping
ask,
the channels
keeping
open.
in touch with people.
Yes, keeping the channels open, definitely, and making it, telling them, even if you are stressed and you're anxious, actually, this is so extremely common and normal, and lots of people in your circumstance are feeling the same way.
Someone else, a comment or a question, especially thinking of how we deal with things in the church. Yes, Rafat.
I'm sorry, Abuna, if nobody else wants to ask a question.
No, please.
It's just on the same point about being intrusive. One of the issues, I personally find it very hard, and sometimes finding about people so late in their problems. And in the same point you're asking about, we have to be asking about people, and sometimes you will be very distressed when you know that somebody is really in deep trouble and the church didn't ask about him, or some other people say, well, the church didn't ask except too late. And I blame myself sometimes that I didn't ask or I didn't know. And at the same time, this idea of being intrusive about or need to know about people. So how can you judge this point, or how can you how can you make a judgment about the best way of dealing with this point? Because that's a question probably you were trying to say, how can I ask about somebody but not being intrusive? And what's the advice from the psychological point, or just a little bit more of the views of everybody about how to deal with this point? It will be nice to know what people feel about it.
Just for me as a priest, I think I need to try and be in touch with people. It doesn't mean I even have to say very much, but if I send a regular WhatsApp message to someone that says, I'm thinking of you and praying for you, it means that I'm keeping a connection with people. It doesn't mean, please send me a reply describing all of your current psychological state. It just means I am here, and whenever you think you need to speak to me, I'm on your side, So from a priestly pastoral point of view, I don't spend all of my time emailing all of you, but sometimes I'll message you, Rafat, and I'll say, I'm thinking of you and praying for you. And that's just my way of saying, here I am, What do you think, Mira?
Yeah, I agree. I mean, you can't really force someone to tell you how they're feeling. This just comes naturally if they trust the person and if they have developed a bond already. So I think number one is build the bond, and that's it, and just leave the actual channels open. People, when they trust somebody, they feel like they can talk to them. And if they are struggling, they know that there is someone that's not going to judge them and they can actually talk to them. So as long as you're available and they know they can trust you, That's all you can do. But actually asking them directly again and again might just make them feel self-conscious. And say, if they have already divulged to you that they have gone through a depressed period, and they've gone out of it again, you kind of bringing it back again and again and again might not be helpful either. So just a gentle step back approach might be more useful.
Yeah. David, your hand's up.
Hi everyone, and we just want to say thank you to Uncle Rafat for his kind words. We miss you all in Manchester and Liverpool too. I just want to raise a couple of points. The first one is something we need to be aware of. We're heading towards some really difficult times in the UK in terms of financial hardship, particularly with the increase of cost of living, etc. So that's something we need to bear in mind, that a lot of people be carrying a lot more burdens than we have previously seen or we anticipate. The second thing is, particularly with regards to young people, I think this has a direct, the hardship, particularly financial hardship, has a direct impact on young people. So for instance, in 10 years in academia, I have not had a conversation like the one I had yesterday around starting food banks for students. We're seeing an increase in the number of students who are facing difficulties, financial difficulties, anxiety, stress. I'm getting emails from students talking about, they can't even afford petrol to go on placement, things like that. This is causing a lot of stress and anxiety on students. So our young people will be suffering some of the stuff that we need to be aware of these things. And I don't think, traditionally, or particularly in the diaspora, the Coptic community has been more affluent than other communities, but I don't think we're as sheltered from these circumstances much longer. I think some of our youth will be going through some of these problems. I've already seen it in some people that we know personally, that they've gone through problems. So I think it's useful for us to be aware of this and factor it in how we approach mental health with young people in our church in general. Thanks.
Thank you, David. Thank you. Any final comments from people before we close? Just Mira, I'll ask you finally then as a final comment. Why in your own reflections do you think it's important that as Coptic Orthodox communities, since that's who's represented here, we take seriously the mental health needs of all of our brothers and sisters? Why do you feel that's important for us?
Because people who have got a mental health condition, they are struggling, they're really struggling. And it seeps into lots of various aspects of their life. So actually having depression is the second leading cause of a disability and not going to work after back pain. So actually being depressed can really affect every part of you. It can affect your home life. It can affect your relationships in the family and outside the family, your relationships with your children. As a church, if you are depressed, you are much less likely to kind of engage with things that will help your depression, like going and having communion and partaking of the sacraments. So it really interferes with people's every single aspect. It can cause them to lose their confidence, to lose their interest in anything, and it can just give them this overwhelming feeling of guilt. So they are just not going to be productive if this is how they're wading through things day after day. Thanks.
And also finally, the needs that each one of us bears are our own needs. No one in the church should ever bear their needs alone, because we are united in one life, we are one body, and therefore when any member of our body, our communities, our congregations is suffering, we all suffer, and in one way or another we do suffer. So it is for the health of us all that we should be concerned for the mental health of those suffering now, those who may suffer in the future, and those around us who aren't members of our church, perhaps aren't Christians, but are struggling with unknown difficulties around us. the Christian message, the good news of life with Jesus Christ, has something to say to them also. And we are the ones that God chooses to use to share that good news. Thank you, Mira. That was a very helpful presentation. And I'm glad I recorded it. It will be very useful for many other people to listen to. Let's pray for a moment. Heavenly Father, we thank you that you care for us in our needs and in our weaknesses, which are expressed in all manner of sickness, disability, and in mental health conditions, as we have considered here. We thank you that as we bear these burdens ourselves, we can discover that you are bearing them with us, giving us strength to cope with them. And you ask us to bear the burden of all those in the church who are facing these difficulties now. Help us to be wise, help us to be insightful, help us to be full of your own compassion towards all those who suffer around us, we pray. And help us to apply some of these principles that Mira has shared with us today for the sake of the well-being of all and of your church community, we pray. Hear us now as we lift our voices to you, our Heavenly Father, and pray to you, saying, Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive those that trespass against us. And lead us not into temptation, but deliver us from evil, through Jesus Christ our Lord. For thine is the kingdom, the power, and the glory, forever and ever. Amen.